So you're here for us to discuss the problem of double chin. Tell me what exactly bugs you about it.
I just, for the longest time, I actually think I'm genetically predisposed to this hanging turkey neck, as I call it. So it's just, you can't be natural because, when you tilt your head the wrong way, you've got this big fat bubble hanging under you. And the truth is it's particularly frustrating because past couple of years I've been working out and trying to, lose weight, tone up, but it doesn't do anything to your chin. So, yeah, it kind of is discouraging.
Yeah, unfortunately, so this is kind of a persistent problem. It can come on kind of early on in your life, and it persists, as you say, no matter how much you exercise and what you do, this fat area will unfortunately stay there. So today, you wanted to talk to me about a product that we're using, which is the deoxycholic acid. It's an injectable product that we put into this area. It's specifically been approved by Health Canada for treatment of double chins. Basically, what this product does is it treats the fat that's underneath this area. It's not a human or animal enzyme. It's a synthetic product that what it does is once it goes into the area, it breaks down the cell wall of fat cells and it causes breakdown of the fat cells. Once this happens, the breakdown products are naturally taken away by your body as your fat in your body would clear out in any way that it naturally would. And basically what you're left with is a fat-free area underneath your chin, which is what we're going for.
Perfect.
Exactly. What it generally does not treat is a lot of loose skin underneath the area. It's primarily, as you can tell, the product is meant to treat fat, and so that's what it does treat. But through an inflammatory process, it does cause a bit of a tightening in this area. Generally, it gives you a very amazing result. Ask me any questions that you have about the treatment.
Just wondering how many treatments you think, particularly on me, it will take. Yeah, roughly. I mean, there's nothing for sure.
Exactly. As you know, every person's different, every patient's different, every chin area is different. Usually with this product, we need somewhere between 1 to sometimes up to even 5 treatments. Usually people fall within sort of the 2 to 3 treatment mark, and I think that's pretty much exactly where you'll be at. You will see results after the first treatment, but I think that you'll probably reach your ideal results somewhere between the second to third treatment.
Okay. So you obviously think I'm a decent candidate for it. So
I think you're a great candidate for it. So ideal candidates are people who really have the double chin isolated to the midline area here, not really going out far, which yours don't. People who don't have a ton of extra loose sagging skin, which you don't have. And then there's something called platysmal bands that are in this area here. The platysma is a muscle that kind of spans our neck, and it's open in this area in the midline of the neck. And sometimes because of that, as we age, little bands of this muscle can develop. If you have very prominent platysmal bands, getting rid of the fat and tightening this area can sometimes accentuate that muscle. However, we try to identify patients with that beforehand, and we'll let you know we do have a great treatment for it, which is essentially inserting a neurotoxin after the treatment into the area to relax that muscle afterwards. And then overall, that'll give a very nice streamlined sort of smoother.
Okay. Then what are kind of the side effects of the treatment? I get that it will hurt, there'll be some swelling, but kind of what are the top 3?
The top 3.
The top 3.
You nailed it on the head. Basically, sort of swelling and bruising, and generally any kind of those side effects that can go along with any injection into your skin or your face area. Those are very short-lived. 24 to 48 hours is the maximum, and then after that, it'll kind of look like your neck does now, and there's a slow tightening that will happen. The very dreaded side effects would be if there's an injection very close to the skin, you can get some ulcers of the skin area. This is something that I haven't seen or anything because the way the product goes in, and in my hands it goes in deeper into the neck. The last side effect that could be seen is weakening of one of the nerves called the marginal mandibular nerve that goes quite a bit further back in your jawline area, which can give a crooked smile. However, this is why we pick patients who only have the fat in this area, and we don't people who, as we say, as the fat goes out more laterally towards the sides of the neck are not ideal candidates because of that nerve. So we stay far away from that.
fantastic. And so what's the expected downtime for you then?
It depends what you call exactly downtime. So there will be, like I said, 24 to 48 hours of some extra sort of swelling and redness of the area, and usually after that it subsides. Most people will return to their activities pretty much immediately after the injection. If you're a little bit shy about the redness or the swelling, you may probably take a day off and stay at home for 24 hours afterwards. It's also an area that's pretty easy to cover up with turtlenecks or scarves, so that's the other bonus to treating that area.
Okay. That's pretty much all the questions. It sounds exciting to me. So like I said earlier, it's exciting and nerve-wracking at the same time. But I'm looking forward to the results. Absolutely, absolutely.
I'll tell you a little bit about how exactly we do it, and then of course you're going to see as we go ahead to do the procedure. Basically what we'll start off with is bleeding off your neck. We're going to put on a topical anesthetic and let that sit so that you get nice and numb in the area. Generally we'll give you some ibuprofen beforehand to also help with the pain during the injections, which between those two things is pretty much completely eliminated. After that, once the anesthetic takes effect, then we'll wipe off the anesthetic. We'll prepare your neck. We'll put a grid on your neck, which will show what our injection points will be. The grid is basically like a stick-on stamp that goes on, and that'll give us a guide to put in all of our injection points. We'll have our needles, everything ready. We'll do the injections, which go very quickly, and then we'll take the grid off your neck, and some ice goes on afterwards. So it's a pretty quick procedure. Any questions about the grid?
No.
There we go. All right. So we have our treatment points marked out now. So we can stop, because now we have. So we're back here 6 weeks now after you did your first treatment, and how was your experience?
It was actually fantastic. I'm very excited about the progress so far after just that first treatment. It was great to see.
Good. And you didn't get too much bruising or swelling?
Not at all. No. I think the first day, the weirdest thing of the whole thing is just the loss of feeling, but that's kind of it. Like, I didn't find the swelling overwhelming at all. Pain-wise, didn't feel pain.
And the sensation starting to come back now?
Oh, it's back now. Yeah, it's all back now until now. It's just been frozen again, but yeah.
Good. Mm-hmm. And how many days after the treatment would you feel like you were comfortable to go out?
Oh, really? The next day I was out and about. Yeah.
Perfect.
Yeah.
Excellent.
Now I could have probably used the excuse to soak it up a bit more, but no, I went out the next day and I was just fine.
Good.
Yeah.
Perfect. So we're here now for number 2.
Yeah.
Excited?
Very excited. Yeah.
Okay.
I can only imagine how much better it'll be. So.
Excellent. Perfect. So let's get going. Ready here. You're going to feel a few pinches as you did last time. You doing okay?
Mm-hmm.